Hi everyone, it is really great to see you all. First of all, how are you? I hope you are in the pink of health. My name is Susanna from the FO1A. Today I am here to present about dissociative identity disorder, in short form DID. I want to divide my presentation into 5 parts. In the first part, I want to tell what is DID and then cause of DID. In the next part, I want to explain about symptoms of DID and then how DID is diagnosed, and lastly, the ways to treat DID. Dissociative identity disorder is a multiple personality disorder. The people with DID develop one or more alternate personality that function with or without the awareness of the person's usual personality. DID is actually a mental disorder that involves disruption or breakdown of memory, awareness, and perception. When one or more of these functions is disrupted, dissociative symptoms can result. These symptoms can be mild, but they also can be severe to the point where they interfere with the person's general functioning both in personal life and at work. DID is actually a rare disorder and it can occur at any age. Females are more likely than males to get DID. And then cause of DID. A history of trauma is a key feature for DID. About 19% cases of DID involve some history of abuse. The trauma is often involves severe emotional, physical, or sexual abuse. It might also be linked to accident, natural disaster, or war, and early important losses such as the loss of parents may be a factor in developing DID. Dissociation is often thought as a coping mechanism that a person can use to disconnect the stressful and traumatic situation or separate the traumatic memories from a normal awareness. It is a way for a person to break down the connection with outside world and create distance from an awareness of what is occurring. Dissociation also can serve as a defense mechanism against physical and emotional pain from stressful and traumatic experience. By dissociating painful memories from everyday thought processes, a person can use dissociation to maintain a relatively healthy level of functioning, thought that the trauma is not occurred. Episodes of DID can be triggered by a variety of real and symbolic traumas, including mild events such as the minor traffic accident, adult illness, stress, or even a reminder of childhood abuse. DID also shares many psychological symptoms as those found in other mental disorders. First one is changing level of functioning from highly effective to disturbed. And then severe headache or pain in other part of body, depersonalization, feeling disconnected from own thought, feeling and body. Next is depression or mood swing, anxiety, amnesia, and then hallucination. Hallucination, they will hear some different voices. Other than that, self-injuries. Example of self-injuries is they will cut their hand or scratch their body. And lastly, substance abuse. Do you know how DID is diagnosed? Let me tell you. If symptoms are present, an evaluation will be done with a complete medical history and physical examination. Although no laboratory test can diagnose DID medically, a variety of diagnostic tests such as blood tests or imaging, X-ray, CT scan or MRIs can be used to rule out the physical illness and medication side effect. If no physical illness is found, the person might refer to the mental health professionals such as psychiatrists and psychologists who is specially trained to diagnose and treat the medical illness. They will perform a clinical interview to get a full picture of the person's past experience and current functioning. Some psychologists and psychiatrists and psychologists will employ some specialized tests such as dissociative experience scale or a standard interview, structured clinical interview for dissociation. Okay, before I explain the treatment for DID, I want to ask you, do you know what are the aim or goal to give treatment for people who has DID? Okay, let me tell you. The goal or the aim treatment is given for the person who have DID is to relieve the symptom, ensure the safety of the individual and those around him or her, and reconnect the different personalities into one integrated, well-functioning identity. Other than that, treatment also aim to help the person to express, process the painful memories, develop a coping skill and life skill, restore optimum functioning, and improve in relationship. Okay, now, first treatment for DID is psychotherapy. Psychotherapy, also known as talk therapy, and it is the main treatment for DID. The second one is creative therapy. Example of creative therapy is music therapy. This therapy allows the patient to explore and express their thought, feeling, and experience in a safe and creative environment. The third one is meditation and relaxation technique. This helps the person to better tolerate with their DID symptom and become more aware of their internal state. And the last one is family therapy. This helps teach family about DID as well as the family members can recognize symptoms of a recurrence. Okay. Do you know who is NFL star Herschel Walker? Have you heard about him? He is one of the famous person who is diagnosed with DID. And he is the American football player. He wrote a book about his struggle with DID along with his suicide attempt, explaining that he had feeling that disconnected from his childhood to his professional. In conclusion, dissociative identity disorder is a complex condition that hugely impacts the life of the person who has it. By long term of psychotherapy, the condition can be managed. Other than that, family love also important things to help the person to overcome the problem. So that it is really important to family members spend their time with family and share the love each other so that the person can live the life as a normal person. I hope my presentation is useful for you to understand about DID. If you have any question, you may feel free to ask me. That's all. Thank you.